Hello, my name is Khalees Tennille and I will be doing my presentation on multiple myeloma. This presentation is not intended for any research purposes. The motivation behind my case study presentation is my grandmother who passed away from multiple myeloma in 2002. I'll be using my mother, Miss Daniels, to help verify the events that occurred during the disease process. Miss Daniels, do I have your permission to record you during this presentation?
Ms. Tennille, you have my permission.
Okay, well, let's begin. Multiple myeloma is a cancer that forms in plasma cells, which are a type of white blood cell. White blood cells protect the body against infectious disease and foreign invaders. Plasma cells help fight infection by making antibodies that recognize and attack germs. Multiple myeloma causes cancer cells to build up in bone marrow where they outnumber healthy cells. The cancer cells then begin to produce abnormal proteins called M proteins, which are non-functional antibodies that can't help fight off disease. The abnormal M protein begins to cause damage to kidneys and bones, which increases the risk of pathological fractures. Multiple myeloma almost always begins with a benign condition called monoclonal gammopathy of underdetermined significance, or MGUS. In the United States, about 3% of people older than 50 have MGUS, and of those 3%, each year about 1% would develop multiple myeloma. MGUS and myeloma are marked by the presence of M proteins, which are produced by abnormal plasma cells. Risk factors for multiple myeloma include increased age, the male sex, black race, family history of multiple myeloma, or MGUS. Multiple myeloma can be difficult to diagnose because some of the symptoms are very general, and sometimes the disease can be asymptomatic for a very long time. Multiple myeloma is a plasma cell malignancy characterized by osteolytic bone lesions, which are softened lesions of bones which form as a symptom of certain diseases such as multiple myeloma. The pathophysiology of myeloma involves increased osteoclast activity and decreased osteoblast activity. Osteoclasts are cells that break down bone and is responsible for bone reabsorption. Osteoblasts are responsible for forming new bone. So simply put, in myeloma, there's an increased number of cells that break down bone and a decrease in the number of cells that help build bone. Symptoms in multiple myeloma can vary, and in early stages in the disease, there may be no symptoms at all. When symptoms begin to occur, they include bone pain, especially in the spine and chest, anemia, nausea, constipation, loss of appetite, pathological fractures, spinal cord compression, fatigue, frequent infections, especially pneumonia, confusion, weakness, numbness in the legs, decreased kidney function, hypercalcemia, neuropathies, and excessive thirst. Multiple myeloma can be difficult to diagnose, and for that reason, physicians use several different methods, including physical exams, symptoms, medical history, and diagnostic tests to help confirm a diagnosis. Initial tests to help confirm diagnosis include blood and urine tests along with a bone marrow biopsy to test for M proteins. Other test methods include X-rays, MRIs, CT scans, PET scans, and genome sequencing. Diagnostic criteria for multiple myeloma requires confirmation of certain criterion, which includes a plasmacytoma finding, which is a tumor of abnormal plasma cells that grows in soft tissue or bony skeleton, elevated levels of plasma cells in a bone marrow sample, elevated levels of M protein in the blood or urine, osteolytic bone lesions, or low levels of antibodies in the blood. There are many different treatment options available for multiple myeloma, but currently no cure for the disease. Drug treatments focus on targeting abnormalities within cancer cells that allow them to survive. Certain drugs block the action of a substance in myeloma cells that break down protein. This action causes myeloma cells to die. These drugs are Velcade, Kyprolis, and Ninlaro. These drugs can be administered intravenously or by mouth in a pill form. Biological therapy is another option that uses your body's own immune system to fight myeloma. These drugs enhance the immune system cells that identify and attack cancer cells. Chemotherapy is a treatment that is more commonly known among everyone, and it kills fast-growing cells, including myeloma cells. Corticosteroids are also administered to help control inflammation in the body, and they're also active against myeloma cells. A bone marrow transplant, which is a procedure used to replace diseased bone marrow with healthy bone marrow. Before a bone marrow transplant, stem cells are collected from the patient's own blood. The patient then receives high doses of chemo to destroy diseased bone marrow. After the chemo is complete, the patient's own stem cells are infused back into the body where they begin building new bone marrow. And the last option is radiation therapy. It's a treatment option which uses beams of energy to damage myeloma cells and stop their growth. Radiation therapy can be used to quickly shrink myeloma cells in a specific area, like a tumor that's causing pain or destroying a bone. Multiple myeloma is not a common cancer, but it's the second most common blood cancer in the United States. The prognosis of multiple myeloma is about 5 years. My case study behind this presentation and my inspiration for becoming a nurse is my grandmother, who passed away May 5th, 2002 from multiple myeloma. I will be interviewing my mother to help recall the manifestations of her disease. My grandmother was 62 years old when she passed away. She had been misdiagnosed for several years. She had anemia for years and was given iron pills to take. She also had a lot of gas and chest pain, and at one point was diagnosed with acid reflux. Then she was told that there was a problem with her gallbladder and she had to take medications to try to resolve that issue. After that didn't work, she was diagnosed with a hiatal hernia. After that, she started to lose weight, and at that point, they finally checked her blood, and she was referred to an oncologist, and the abnormalities were found, and she finally saw the oncologist around May of 1999. The oncologist did a bone marrow biopsy on her that day in his office, and she was diagnosed with stage 4 multiple myeloma a few days later. The disease was initially attacked with a very high dose of chemo given IV in the doctor's office over several hours once every 4 weeks. She was also given chemo pills and Decadron to take by mouth. She was very nauseated about 2 weeks of every month while doing the chemo treatments. She would do the treatment for 6 months and then take about a month break and start over. She was eventually told that it was not working. They then wanted to try a stem cell transplant, but after a thorough assessment, it was determined that she was not a candidate for a stem cell transplant because she was just too weak. She was then started on an even higher dose of chemo until she got accepted into a clinical trial that used a 3-part drug treatment, including bortezomib, ascorbic acid, and melphalan. And we remember that because the ascorbic acid burned her mouth. Her initial prognosis was 3 to 5 years, and she lived almost 3 years exactly from the date of her diagnosis. So, Miss Daniels, what do you remember about the onset of her symptoms?
Well, I remember that initially she was a really strong woman. She was very rarely sick at all. But then she became ill. She'd always, for a number of years, been anemic. And they would just give her iron, you know, to rebuild her blood. And she was a woman of age that it could have been other things making her, you know, lose blood and all. So she didn't think anything about that. Then she started to have pain in her rib area.
Upper abdomen area.
Mm-hmm. And they thought that was acid reflux. They gave her Pepcid and some other stuff for that. They went on, they thought it might be her gallbladder,
Hiatal hernia.
then a hernia, and finally they did test her blood. She started to lose weight, and they tested her blood, and I guess they found some things that concerned her,
proteins.
and they referred her to an oncologist.
So she finally saw the oncologist. Her first day at his office, a bone marrow biopsy was done, and it took a few days to get the results. But when she was initially diagnosed, the cancer was already stage 4, which is the worst stage of a cancer. So for treatment options, she began the IV chemo, and she would do that once every 4 weeks. Once every 4 weeks for about 6 months
at a time.
And then she would get a break and have to start back.
Right.
So then she was chosen as a candidate for a clinical trial, and she tried that for a while, and that didn't work. So then they wanted to do the stem cell transplant, and after thorough assessment, she just wasn't a candidate for the stem cell transplant. So the last option was just a higher dose of chemo that her body just was not able to tolerate. She was actually put on the ventilator several times. But
she always came back and started breathing on her own.
But the last time she just really wasn't able to come back from it, because the drugs used to treat it is just so aggressive that it takes a toll on the body.
Right.
Well, in remembering, say it's not, all bad. The positive aspect to this is, you want to talk about that?
Well, my mom passed away on May 5th. She was laid to rest on May 9th. May 12th that year was Mother's Day, so that was really hard on us. And her birthday is May 23rd, so May was not a good month for us. But May 23rd turned out to be sort of a redemption day, because she passed in 2002. In 2017, Kay gave birth to a little girl who actually has my mom's spirit, sadly. But she was born on my mom's birthday, so we feel like that that God gave us a gift back to help us remember her. So.
And the last slide is my grandmother right here and my daughter Cassie Bug. Thank you for your attention, and I hope you've enjoyed my presentation. Thank you, Miss Daniels.
Thank you.